With progress in the treatment of the #1 disability in the country. 1 in 4 adults in this country know the pain of arthritis. For some, it's an occasional ache. For others, it's debilitating. Michelle Murchison was diagnosed with a form of arthritis at 18 months. It's all she ever knew growing up.
They're invisible diseases. I do think that your baseline is just pain. Like, I've never not walked without pain.
Yeah, I know when she was a kid, there just weren't many treatment options. Today, fortunately, there are many, and they're all needed because there are more than 100 different types of arthritis-related conditions. Some are caused by injury or age, think osteoarthritis. Others are the result of an immune system out of whack.
Our immune systems are very potent in keeping us healthy by fighting off bacteria, viruses, and fungi in the environment that could make us sick. But when the immune system gets confused, it could cause all sorts of damage and disease and even death.
That is Dr. Gordon Lamb. He's a rheumatologist at Arthritis and Osteoporosis Consultants of the Carolinas. He says the hunt for answers is what drew him into rheumatology.
Yeah, so when I was in training, we didn't have very many options. Unfortunately, people in rheumatology offices were in wheelchairs. They were walking with canes and crutches. But now we have such great medications that our goal is to get patients into remission.
When you can tell them that that's possible, what's that reaction like, and what does that mean to you to hear that reaction?
One of the greatest things that we can do as practitioners of medicine is to give people hope, to give them optimism. So when you say that, they kind of look at you quizzically because they never realized that that was a possibility. They've been suffering for so long. So for them to realize that it's possible to get better, it's possible for them to have their lives back again, I think that's one of the greatest satisfactions that at least I have as a doctor.
There can still be frustrations though, right? Because it's finding the medication that's going to work because everyone's different.
So Jamie, as you mentioned this, and I'm not just saying this, but I was getting chills because you're right. In medicine, we still practice the old trial and error approach. We try medicine. If it works, great. If it doesn't, we move on to the next thing. But here's where the hope is. And one of the most exciting areas of research are these predictive biomarkers. So that is trying to find tests where we can predict what medicine a patient may respond to. And therefore, we can get them on the appropriate therapy faster.
On the osteoarthritis side, what can we do to stave that off? How can we do that to sort of ease that pain?
But that's one of the disease states where it's a little bit frustrating because we haven't had as many advances in other types of arthritis. But I always tell patients with osteoarthritis, diet, so an anti-inflammatory diet, weight loss, if appropriate, are very key to maintaining joint health. But the key is that we want to keep people active. We don't want them to be overactive, but we always say in arthritis that for the joints, motion is lotion. So we want them to keep moving to make the joints feel better and so that they can continue to be able to move in the future.
Yeah, Dr. Lamb, very optimistic. He thinks a cure is coming soon. Now, the work Dr. Lamb is doing will be recognized this weekend at the Jingle Bell Run in Uptown. The 5K Run and Walk helps the Arthritis Foundation fund more research. Hope you can come and join us. I'm going to be there. Registration in front of Truist Field starts at 9 a.m. The run starts at 10. For more info, go to WBTV.com/webextras.